Will the Committee of Supply please come to order? This section of the Committee of Supply will now consider the estimates of the Department of Health, Seniors and Long-Term Care. Does the Honourable Minister have an opening statement?
I do.
The Honourable Minister of Health, Seniors and Long-Term Care.
Thank you, Chair. I'm pleased on behalf of the Department of Health, Seniors and Long-Term Care to present the financial estimates for the 2024-2025 fiscal year. This is a historic budget with a record investment into healthcare. With it, we are delivering on our commitment to Manitobans to clean up the mess of the past over 7.5 years and begin the work of fixing Manitoba's healthcare system. It is indeed a new day in Manitoba. This budget is the first in the legislature in a long journey for us as a new government, but in undoing the work, the damage rather, done by the previous government. This budget is a great first step with tangible, ambitious targets that are undoubtedly moving us in the right direction, and ambitious targets that reflect the ambition of Manitoba's healthcare workers and communities who count on a government being ambitious to repair damage done over 2 terms of a previous government. Fixing healthcare is our government's #1 priority, and we are demonstrating that with a record investment of $8.2 billion. That is an increase of $980 million or 13.5%. We're investing $309.5 million in staff retention and recruitment, $635 million in capital, and $65 million toward reducing emergency wait times. These investments demonstrate our commitment to providing quality care where and when Manitobans need it. It reflects the growing need for healthcare services as Manitoba faces both a growing and increasingly diverse and aging population. Patients are at the heart of every decision made in this budget. As a psychiatric nurse myself, this is a fundamental principle in how we implement improvements to healthcare. Patients are at the heart of healthcare, and it is care and passion for patients that motivates Manitoba's healthcare workers, whether they're nurses, allied healthcare professionals, doctors, support staff. That's what motivates them to show up every single day providing the care that they do to Manitobans. And ensuring that healthcare workers have the proper tools to care for their patients is paramount. A sustainable and respectful workplace environment is crucial in creating the best possible health outcomes for Manitobans. That's why this budget, beyond making historic financial investments, puts more resources on the front lines, reduces bureaucracy, and works toward the goal of changing the culture in healthcare. This budget recognizes that solutions are found on the front lines, and it prioritizes that fact. This work is a calling. I know that because I had the same one, and answering that calling is a remarkable thing. These vocations deserve admiration, gratitude, trust, and respect. This budget hires more doctors, nurses, increases staff and patient safety within our emergency departments and other sites, and invests in human resources. Addressing the staff shortages in healthcare is the first step to repairing our system. That means making Manitoba a place where healthcare workers want to work again. And that's why we're making recruitment and retention an absolute top priority. And we're doing that by opening a new healthcare retention and recruitment office, expanding the nurse float pool, including a $291,000 expansion in northern Manitoba, increasing medical residency spots by 38%, investing $3.9 million in provincial nursing stations, adding 30 new seats to the University of Manitoba's undergraduate medical education program, incentivizing medical students to enter family medicine and streamlining their training process, establishing a satellite medical school in Brandon, increasing funding for the nurse diploma program in Nipawa, and bringing back rural paramedics to the front lines of healthcare in their communities and empowering them on the front lines. We're also increasing funding for interprovincial training agreements by $625,000 for a total amount of $8.2 million. This funding will support the training for healthcare workers who want to come to Manitoba. When we talk about reducing emergency room wait times, it's important to note that in our budget, we commit $65 million toward reducing those wait times and ensuring better and faster patient care. At the heart of this is retaining and recruiting staff and ensuring our emergency departments are safe spaces for all staff and all patients. We also know that we need infrastructure, and so We're adding 151 new acute care beds across the province. For years, cuts to acute beds across Manitoba created shortages and exacerbated wait times for patients. This is something that we've heard all too long and know all too well firsthand from Manitobans. It's important to note that we are also improving patient flow through our hospitals with new lower acuity beds. This will open up more critical care and acute care beds for Manitobans. This way, patients most in need of acute care will get the care that they require faster. We're also investing $6.9 million in ensuring patients can get home sooner by increasing weekend patient discharges, addressing the weekend effect as noted by frontline healthcare professionals. Patients will no longer have to wait until Monday to get home. With an increase in allied healthcare worker hours, we can increase bed availability and get patients who are ready to go home back to their families sooner. Our government is investing $4.2 million in establishing 10 community paramedicine units to increase advanced levels of care throughout the province. We gathered with dozens of healthcare workers outside of the Victoria General Hospital to announce increased investments, including the reopening of the emergency department at that hospital. We're restoring critical care capacity by establishing permanent funding for 30 ICU beds with a $25 million investment. We know that we need permanent ICU capacity to get Manitobans the care that they need, a component that has been neglected and cut terribly over recent years. So let's talk about seniors. It is a new day in Manitoba for families and seniors. Our government has worked hard to secure investments from the federal government and to ensure that Manitoba seniors get the quality care they deserve. We're investing over $21 million of new funding that enables Manitoba seniors to stay in their homes if they so choose. And our new Safe and Healthy at Home program will increase hours of home care. We've also announced a 95-bed personal care home in Lac du Bonnet. This is the first of 4 personal care homes that our government is building. And we're creating the long overdue Seniors Advocate Office, independent Seniors Advocate Office, which will identify, review, and analyze issues facing Manitoba seniors. So, Budget 2024 is all-encompassing. With investments in minor injury clinics and increased training capacity, more Manitobans and their families will be connected to a doctor and primary care and team-based care. Our $50 million investment in a new healthy system innovation capacity fund will help build surgical capacity here in Manitoba. Our investments in cancer care including increased access for cancer drugs and plans for a new cancer care building are steps toward making sure more Manitobans hear those 4 magic words: you are cancer-free. With our investments in paramedicine services, MRI access, doctor recruitment, transportation improvements, and capital investments, including the Carberry and Ericsdale emergency departments, we are ensuring better care for rural and northern families. And as we implement better culture across Manitoba and work through partnerships with groups like Aboriginal Health and Wellness and Gani Kanichik, we are delivering on our commitments to improve health outcomes and provide better care for Indigenous families. With a $37 million investment in the front lines and frontline organizations, we're also improving access to preventative care. Now, these are just some of the high-level broad strokes of Budget 2024, and I want folks to know that we are committed to bringing care closer to Manitobans in their communities, investing in capacity, hiring, training, retaining more healthcare workers, reducing emergency and surgery wait times, and building new capital. This budget makes good on these commitments to Manitobans. Budget 2024 has laid out our government's vision for healthcare in Manitoba. And so to close, I want to thank the nurses, doctors, allied healthcare professionals, physician assistants, support staff, facility staff, the CAs, all the folks working in our system, the civil servants who work tirelessly to deliver care to Manitobans each and every day. And I want this budget to serve as a message to Manitobans that wherever you are, whether you're in the south of Winnipeg, Thompson, Carberry, in the north, rural areas, in the suburbs or urban centers, you deserve quality health care where and when you need it, and you deserve that care close to home. Thank you.
We thank the minister for those comments. Does the critic from the official opposition have an opening statement?
I only want to
The member for Roblin?
thank you. I only want to extend my thanks ahead of time to both staff from clerks and the pages who are here to assist us with this process, but also to the deputy minister and other departmental staff. I know this process is a lot of work for you, and I appreciate it. And it's an important part of how we get a budget through this legislative process, as I know you know. So thank you for all of your work in advance. And then I would like to just get straight into questions.
Thanks.
We thank the member. Under Manitoba practice, debate on the minister's salary is the last item considered for a department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 21.1A contained in Resolution 21.1. At this time, we invite the minister's staff to join us at the table, and we ask that the minister introduce the staff in attendance. Okay, so the minister, her seniors and long-term health, long title.
How dare you? No, I'm just kidding. It's fine. Yeah.
Minister of Health, Seniors and Long-Term Care.
Great, thank you so much, Chair. All right, so first I wanna say thank you to these folks for not only being here today, but just for their outstanding work from day one. We are so fortunate in the Department of Health, Seniors and Long-Term Care to have absolutely wonderful human beings doing this work in the civil service, but just rock star professionals, hardworking, super smart, responsive people. And I feel very, very grateful to not only be at this table with you folks, with these folks, but Manitobans are fortunate to have this kind of leadership in the civil service. So we have Deputy Minister Scott Sinclair, Suzanne Gervais, who is the Associate Deputy Minister. We have Sandra Hinault, who is the Assistant Deputy Minister and EFO. JP Fredette, Assistant Deputy Minister. We also have Alyssa Brandt, Director of Ministerial Affairs. Raina Loxley, Special Advisor. Thanks.
Thank you, member. According to our Rule 78:16, during the consideration of departmental estimates, questioning for each department shall proceed in a global manner, with questions put separately on all resolutions once the official opposition critic indicates that questioning has concluded. The floor is now open for questions. The member for Roblin.
Thank you. I'm going to start with some questions just to get kind of a baseline on where things are at in the department. On page 33 of the actual budget document, there's a reference to something called the 4321 staffing plan. I haven't seen a reference to that anywhere else, and so I'm just wondering if you can elaborate on what that is.
The Honourable Minister.
Great. I thank the MLA for Roblin, the critic, for that question. So the 4321 that you're referencing, that you're referring to, that is a commitment that our government has made to hiring 400 doctors, 300 nurses, 200 paramedics, and 100 healthcare aides. And so in our capacity for quite some time, actually predates forming government, but certainly since forming government, we've been very clear with Manitobans that our number one priority in being able to successfully move healthcare in the right direction is going to be rooted in staffing. It's going to be about our ability to retain, recruit, and train the number of healthcare workers that need to be across our healthcare system. The 4321, those are numbers that are directly related to areas where we saw previous cuts in healthcare. So we know that for a few years, it's been reported that Manitoba has a shortage of 400 plus doctors in the province. We knew that 300 nurses have been previously deleted, fired from the healthcare system. 200 paramedics were lost across the system. Almost 90 alone in rural Manitoba were cut previously. And these are important targets to make sure that we are moving healthcare in a direction where we're stabilizing staffing. I think it also really reflects to Manitobans that our government recognizes the value in recruiting and retaining and training diverse demographics of healthcare workers. So we've talked about team-based models of care. When we embarked on our listening tour, the decision to make sure that those spaces were welcoming to all healthcare workers, frontline healthcare workers, I think really reflected that. So making sure that whether you are a nurse, an allied healthcare professional, healthcare aide, doctor, facility staff, it's been really interesting actually to be on the listening tour and hear from hundreds of healthcare workers. But what's been really great, and it brought me back, the first stop that we had really brought me back to how I started my nursing career on a multidisciplinary team where everybody's expertise was valued. And so whether you were a nurse, a doctor, housekeeping staff, you worked in the cafeteria, everybody's voice and observations in terms of healthcare mattered. And so being on the listening tour and seeing folks show up from all disciplines in healthcare to contribute their voices has been really great, because I think that people are seeing that our government really respects the diversity of healthcare professionals who contribute to the care that Manitobans count on. And so the 4321 plan speaks to the targets that our government has set in order to ensure that we're moving healthcare in the right direction, that we can staff the investments that we're making, and that we can action what it is that we're hearing from the front lines from healthcare workers. And we've heard really plainly that this is a top priority for everybody. This isn't a decision that was made or an approach undertaken by our government that was done on a whim. This really reflects what we heard for years, and it reflects what we heard on the doors, and it reflects what we continue to hear from Manitobans, that they want a government that's committed to taking a really dynamic approach to retention, recruitment, and training, getting as many voices heard as possible, contributing to the ways in which we're going to work together to strengthen healthcare. And so that's reflected in the 4321 approach. It's interesting as well. I want to note that we outlined that in our budget to make sure that Manitobans see that our budget, in terms of investing $309 million into retention, recruitment, and training, it's important for Manitobans to see that consistent message around what our targets are continues to be a priority for our government, that we are accountable to Manitobans in the ways we've made that commitment. And so whether it's embarking on a listening tour, whether it's making those specific investments, talking to healthcare workers each and every day, they hear very consistently from us that our priority is making sure that we are addressing the healthcare human resource challenges in the healthcare system. And outlining that 4321 plan really allows for Manitobans to easily grasp what our government's message and aspirations are. And again, it allows for Manitobans to also check in with our government and hold us accountable to where we've landed on each of those points.
Thank you, member. Thank you, Minister. The Honourable Member for Roblin?
Okay, thank you for that answer. Can you tell me then, these are separate then from the 1,000 healthcare workers promised for this year. So what is the timeline on those overall numbers that you just mentioned?
The Honourable Minister?
You're not even ready. You're not even ready. I'm kidding. I'm sorry. Okay, so you asked for a time. I think the member asked for a timeline, and so that commitment was over a 5-year period. So the 4321 was over a 5-year timeline. And so I know that, because I've had this conversation with some folks in terms of what does that mean, with the 1,000 healthcare worker target and the investments that we're making. And so I do think it's important it's important to flag the work that's being done to achieve that. And so the target that we've set in this budget, the way that we've invested in the 1,000 healthcare worker target is really, really ambitious. It's very, very aggressive, but it's a target that was set based on the work we've been doing in partnership with colleges, with organizations, health leaders, frontlines, recognizing that it's an all hands on deck approach, that the way in which we're going to be able to successfully retain, recruit, and train people requires a unified approach in this matter. It's part of the reason why it's been really wonderful to go out and talk to Manitobans and explain the approach here, but to do that alongside, the College of Physicians and Surgeons, Doctors of Manitoba, the College of Registered Nurses of Manitoba, College of Registered Psych Nurses of Manitoba, Licensed Practical Nurses of Manitoba, PARAM, College of Family Physicians. These are all organizations that do a tremendous amount of outreach and work with their members and have a good understanding of what's going on the front lines in sort of a grassroots way in many ways. They're also responsible for regulations, policies, et cetera, that we have to work in partnership with them in order to advance policies that support our ability to meet these targets. And, there's a few things that I think are really important to note, to highlight, because, healthcare is challenged across the country. It's a national challenge that we're facing, but Manitoba, there are good things happening in Manitoba. There are great things happening in healthcare in Manitoba. And it's really important that we say thank you to healthcare workers and we celebrate them. And I think it's also really important that we share the positive impacts of the relationships that we're building and that we're repairing with healthcare workers. It's reflected in some of the outcomes that we're seeing now. So a good example would be being able to create a new mentorship program, nurse mentorship program in partnership with the colleges, so that recently retired folks have the option to return to practice if they'd like. I met a woman in rural Manitoba, Lacta Bonnie actually. She was really, really excited to state that she recently retired and was actually very excited for the opportunity to return to practice in Manitoba, and that she appreciated pathways being made easier to do so, and she wanted to make sure her voice was heard in ways that we can work together and learn from folks like her to make that pathway even easier. Taking steps like training the first cohort of institutional safety officers in Manitoba's history, getting these folks trained to get them on site to protect workers and patients in healthcare settings. I've had conversations with healthcare workers across the province, be it in Winnipeg or in rural settings, northern Manitoba, who are quite frankly relieved that ISOs are finally going to be on location. In several locations already are. And so it's taking steps like that that show Manitobans and show healthcare workers and patients that working together gets things done. Something I think it's important to highlight, because it is part of our 4321 plan as it pertains to physicians, we increased medical residency spots in Manitoba by 38%. And we did that to attract more doctors from out of province to finish their training and secure good jobs here in Manitoba. Now, we have done something collectively here in Manitoba that's pretty special. We have the highest number of spots that were successfully filled in Canada, 173 seats, all of those spots filled in our province, which is something to be really, really proud of. 48% of those folks are going to be in rural and northern Manitoba, which is significant. And so out of 18 new seats that were added, 11 of those seats are in rural communities, and that's huge. We know that when folks train in rural settings, they're more inclined to stay in practice in those settings. And so we're going to continue to do more work. The work is by no means done. We're still doing a lot of heavy lifting alongside our partners, but we're certainly seeing the benefits of partnerships and respecting frontline healthcare workers having an impact in the system. So more work to do, but Budget 2024 gives us the tools to do that work.
Thank you, Minister.
That was a very long answer.
The Honourable Member for Roblin.
I'll put that on the record. That was a very long answer to a short question. That was impressive. Okay, so I just want to make sure I have this right. We've got two different sets of commitments here. We've got the 4321 commitment, which is over a 5-year period. 400 nurses, 300 doctors, 200 paramedics, 100 healthcare aides. Then we have the Budget 2024 commitment, which just 210 nurses, 100 doctors, 90 paramedics, and 600 healthcare aides this fiscal year. For both of those sets of numbers, are these net new positions to the system? Are these filling existing vacancies? What's the breakdown there?
The Honourable Minister.
Thank you, I think the MLA for Robin for that question. So we are looking at those numbers being a net gain to the system. I think that you asked something really important though. Is it about filling vacancies? Like what is it? And it's an all of the above approach. You listed one item, but it's an all of the above approach. So it is going to be about retention. And I've said this already, but I'll say it again. It is about retention. It is about being able to train people. That's a big part of it. And it is about being able to recruit. So there are a couple of areas that are particularly interesting because other jurisdictions have really leaned into those opportunities, whereas Manitoba hasn't particularly been in that space historically. And so one would be, I guess just as an example, advanced care paramedics. That's a good example. So advanced care paramedics have been able to practice in Winnipeg. I know that the critic knows that. But for the past several years, they did not have the ability, they weren't allowed to practice in rural Manitoba, which is a challenge. We lost, it was almost 90 paramedics in rural Manitoba, but there weren't the same opportunities in rural communities for them to practice to their full scope as ACPs. And so, adding training capacity right away, supporting folks being able to access that training, making sure, as the member has indicated, that we're taking steps to fill vacancies and supporting those opportunities is really key, not just for paramedics, but for other areas of healthcare as well. A big part of the reason why we stood up the recruitment and retention office is because folks, and I think a part of why is because they felt like they had to protect their own space or their own lane, but many folks were just operating in these silos, not really working in a connected manner. And so standing up the retention and recruitment office allows the opportunity for a centralized, cohesive approach, allows the opportunity for folks to have a spot they can go in office that they can work with to do a lot of this work. It's an approach that will support, no matter where people live across Manitoba, will support folks in being able to access expertise to successfully retain, recruit, and train folks. One of the other areas that Manitoba hasn't really historically been as engaged as other jurisdictions is around encouraging people who have maybe born and raised in Manitoba but have left to go practice elsewhere, do residencies elsewhere, to come back to Manitoba. That's a space where there had been a gap. And so the recruitment and retention office, also doing work around that and finally getting Manitoba maybe the language "get into the game" isn't the best language, but, getting Manitoba into that space and speaking to our own folks, who we know many of which want to come back to Manitoba, but it's being able to reach out to them and say that we have an opportunity here that's really, really important. And so, the way that we're going to achieve these really ambitious targets is going to require a really dynamic and nimble approach, and by working in collaboration with folks across the healthcare system and listening and learning from people who have direct lived experiences in these areas. And so, a good example would be Carberry. Getting that emergency room reopened, enhancing access to primary care, and folks heard it directly from the mayor of Carberry. They heard it directly from the Health Action Committee. They heard it from council members. They heard it from nurse practitioners, nurses alike. That was a team effort. That wasn't government going in and saying to Carberry, this is what's going to get done and how. It was government extending a hand out and saying, we're here to listen. It was Carberry coming to government and saying, we need you to listen. These are our issues and we want to work together. It was Prairie Mountain Health. It was the Health Action Committee volunteers. It was everybody coming to the table focused on solutions, focused on relationship building and working together to make healthcare stronger in their community. And so that approach is the approach that is going to best benefit this work and best benefit Manitobans. And the ability for us to have net success is going to be rooted in that. And it's a good way. It's a good way to do this work. And so I feel pretty grateful in the willingness of Manitobans, be it health leaders, community members, experts, frontline folks, to do that work collaboratively.
Thank you, Minister. The MLA for Roblin.
Thank you. I just have a couple more questions about these staffing targets. Of the numbers for both the overall 5-year target and for this year's target, are these, for example, 210 nurses, are these 210 FTEs, or is this, for lack of a better word, 210 bodies, whether they're in a casual, part-time, or full-time position?
Thank you, Member. The Honourable Minister.
I believe the word was people that you were looking for, people. Yeah, it is people. And that's typically the way that it's been, I believe, structured historically. That's just the approach in terms of counting those numbers of net benefit or attrition, et cetera. The reality, I mean, healthcare has changed a ton. The critic knows this. It's changed a lot, and so people's needs have changed. Their desire for particular positions has changed, and creating the opportunities for that flexibility is really important. I remember when I graduated nursing school and was looking for a job. At that time, everybody was competing for full-time work. It was a fight to get into a particular setting and use your skills, but it was also a fight to try to find that full-time FTE. And things have really changed. Folks are looking for different ways of practicing. I know myself, I worked full-time and part-time for the entirety of my frontline career. And that worked really well for me in my life and my lifestyle and balance. I really enjoyed it. I had good diversity of practice, which was wonderful. And we're seeing that from folks. We've heard from students at our frontline listening tour who are really interested in not just frontline practice, but also research and innovation. I met a nurse the other day at the listening tour who was a psych nurse and is becoming a physician assistant, I believe, which I thought was really cool, really, really cool. And so healthcare workers are increasingly looking for diversity of practice, but they're looking for work-life balance, stability, flexibility that meets their needs. And so as we work in collaboration with our partners to do the work of retaining, recruiting, and training and creating opportunities that meet healthcare workers where they're at, it is important that we allow ourselves the ability to be flexible and be a listening government that can adjust where needed and make sure that we've got opportunities available for folks that reflect the increasingly diverse needs of the workforce. And to me, supporting the diversity of the workforce is what contributes to innovation in healthcare. I shouldn't say to me, that's science and data and evidence tells us that and shows us that. Diversity in the workplace leads to innovation and fosters environments where more and more people feel safe to receive care and have improved outcomes. And so, increasing the numbers of folks on the front lines is also attached to an approach that, we believe needs to be rooted in supporting a diverse frontline, diversity in healthcare teams, multidisciplinary teams, and really doing this work in a way that is constantly checking in with folks on the front line so we have a good sense of what their needs are. And so I try to reassure folks that this listening tour is not just for 7 months or for 1 year. This listening tour is going to be ongoing. And listening tour sometimes happens in the grocery store. Sometimes it happens, at the park with my nephew. You run into people at Home Depot, and they want to talk about healthcare, and they want to talk about how we can make healthcare better. And so we're always listening and always working to find ways to not only have a net benefit to the system of people, but have a benefit to the system that allows for a diversity of people to practice in the capacities that they identify really meets their needs.
Thank you, Honourable Minister. The member for Roblin.
Thank you for that answer. Can the minister provide the current nursing vacancy rate by RHA in Manitoba?
The Honorable Minister.
So for the WRHA, up until March 31st, 2024, the rate was 14.7%. If the, it's going to take us some time to get the other ones, but yeah. So we'll start with that. Would the member like additional SDOs or?
The Honorable Member for Roblin.
Feel free to take it under advisement and get it back to me. That's fine. I don't need it today.
The Honorable Minister.
I will take it under advisement from the member. Yep.
The Honorable Member for Roblin.
Thank you. I appreciate that. I just want to move on to a couple of questions about departmental staffing. So page 11 of the supplement indicates a reduction in core staffing within the department from 749.3 FTE to 703 FTE. And I'm just wondering if the minister can elaborate on what those positions are.
The Honourable Minister.
Okay, I'm gonna sort of walk the member through some of this, if that's okay. So the total number that she provided, a portion of those were unfilled, never filled contract task force positions. So these were temporary positions that were created, my understanding, for that purpose, but were never actually filled. There's additional 15 that were COVID-related that were also unfilled. So they were temporary positions that were specific to COVID work. And as that work, I guess, was concluded, those positions were no longer existent, actually. So they were actually vacant roles, and they were specific temporarily for COVID. And the others were related to seniors, so the seniors, previous seniors department. And so when that consolidation occurred, those roles were, they ended up being duplicate roles. So those folks are still working, but, and in roles, obviously, but there's duplication there because of the consolidation. So that totals up the number that you provided.
The Honourable Member for Roblin.
Thanks. Can the minister just provide the actual breakdown? They mentioned 15 COVID-related positions, which I take it are the 15 public health positions that were eliminated. I think I saw that somewhere in the supplement. If I'm wrong, please correct me. Specifically, I'm looking for the number of vacant task force positions that they referenced and the number of seniors-related positions that they referenced.
The Honourable Minister.
You can keep, yep. So in regards to the positions, I do think it's important to note that in the months that we've been in government, the priority being to staff the healthcare system, to repair relationships with healthcare workers, to invest in adding back capacity to the healthcare system, recognizing that Manitobans have all been through an incredibly difficult past several years. And it's interesting because when we look at the opportunity to do that work, so specifically, positions around COVID, we know that, these positions in particular were meant to be temporary positions that address COVID. Thankfully, we are long now out of the thick of COVID, thankfully, but also recognizing that what we learned from COVID is that we have to prioritize making sure that we have a resilient, a supported frontline healthcare system that no matter what happens, folks are available and able to respond. And so recognizing that although there may be situations where temporary staffing resources were needed, that what we learned from that is that it's better to be focused on adding capacity, and that our priority cannot be creating chaos in a healthcare system. It cannot be cutting jobs from the healthcare system. It has to be retaining, recruiting, and training folks of diverse healthcare backgrounds. And so necessarily, some steps were taken during the pandemic across not just Manitoba, but other jurisdictions as well. Healthcare workers were, thankfully, they rose to the challenge of COVID. And, now our government's responsibility is to rise to the challenge of creating a healthcare system that really supports them being the best that they can be on the front lines of healthcare. And so, I think that it's important when we talk about what staffing used to look like during these times where that were very difficult, it also does have to inform the approach that our government takes moving forward. And so investing in long-term capacity, not just stabilizing the healthcare system now. Our government is focused on, yes, investing in retention training, recruitment, all of that for right now, and working really aggressively in terms of timeline to do that work and set these ambitious targets and achieve them. But we're thinking long-term about what does a healthcare system in Manitoba need to look like long-term, so that should we have a challenge of an endemic or pandemic or what have you, that we're well positioned to respond, that we're never again in a position where Manitoba has some of the worst outcomes in North America, some of the worst outcomes in Canada, that instead Manitoba is a leader in healthcare in ways that positions us really well to provide the care that Manitobans count on when things are tough. So in reflecting on some of those positions that were specifically temporarily for COVID, I think it's important to talk about what we've learned, what we should have learned from COVID, and how we apply that to our staffing approach moving forward.
Thank you, Minister. The Honourable Member for Roblin.
Okay, so I'll ask the question again. I'll be clearer this time. So of the 46 reduced positions in core staffing within the department, the minister indicated 15 of those were COVID-related positions. So I'm looking to confirm that those are the same 15 positions eliminated from public health on page 39 of the supplement. That leaves 31 remaining positions. How many of those are from the task force, and how many of those are seniors-related positions that were eliminated because they were duplication?
The Honourable Minister.
Okay, so thank the member for that question and for clarifying that question. I appreciate it. And so the seven, as I stated before, with the change in departments, so that was a consolidation of those positions. They were moved elsewhere in other departments. The public health positions, so those were specifically for COVID. Those were temporary roles that had been vacant for quite some time. So my understanding is for many, many months, actually. There was nobody in those positions. They had done work specific to some data entry that was related to COVID that was concluded quite a while ago, like early maybe 2023, somewhere there. And the task force related, so the 24 performance and oversight, those were never filled task force related contract positions. So we've talked a lot. I think we've talked a lot. Our government has talked about reducing bureaucracy and redirecting resources to the front line. And this would be a really good example of that. And so here you have unfilled, vacant positions, been vacant, unfilled for quite some time, that were meant to be temporary, specific to COVID and other challenges. And reducing bureaucracy means being able to identify vacancies like that. The task force ones specifically, I think, are really interesting because those are created for contractor roles but were never utilized. And so those changes were made as part of our broader approach to make sure that we are redirecting the resources that we have directly to the bedside, to the front lines of healthcare. And I hope that clarifies the question for the member.
Thank you, Minister. The Honourable Member for Roblin.
Okay, thank you. I just need to go back. I apologize. I skipped a question that I intended to ask. Back on the staffing targets. Of the numbers that were provided for the overall 5-year staffing target and the fiscal 24 staffing target, where will these staff be located? Like, for example, of the 210 nurses that the government is aiming to hire this year, where in the system will those nurses be located? And same question for doctors, paramedics, and healthcare aides.
The Honourable Minister.
I thank the member for that question. I think it's a really good question, an important one in terms of what is our approach going to be and where do we maybe hope these folks will go. We recognize, I certainly recognize that, I mean, we'll hire as many folks as we can, and we will hire them wherever they would love to work, right? We want to make sure that all across Manitoba, be it in Winnipeg, rural and northern communities, that we are supporting folks in being hired absolutely everywhere across the province. We also recognize, and I'll reference Carberry again as a good example, that there are specific areas, regions, parts of the province that maybe have unique challenges in staffing. And so making sure that we are taking a nimble and targeted approach, understanding the needs of particular communities is key in order to make sure that we can successfully hire and recruit and attract folks to these particular areas. So if we were to look at paramedics as one example, you know, our primary area of staffing is in rural Manitoba. That's really what we're responsible for in terms of staffing paramedicine, is in rural communities, which is why it's so important to make sure that rural paramedics have access to practice to their full scope and ability, access to advanced care paramedicine training, access to the opportunities to practice to their full scope across rural Manitoba. If we take a look at nurses specifically, that the target of nurses that we intend to bring into the system, attract into the system and retain, our government in this budget is adding 151 new beds to the healthcare system. Those are acute care beds, those are lower acuity beds, those are cancer care beds, those are psychiatric beds. There's a diversity of beds that are being added to the system, and we all know that a bed is just a bed without staff. And so taking an approach that ensures that we are working with our partners, utilizing really innovative approaches in Manitoba, like the nursing float pool. Investing in the float pool is investing in innovation in Manitoba. And our investment in the nursing float pool is to allow for nurses to work across rural Manitoba, in northern Manitoba, in Winnipeg, to work not only full-time but part-time as well, to give them the flexibility to participate in a model of service delivery that allows for work-life balance, gives them flexibility, incents their capacity to work, builds cohesion and collegiality in terms of the relationships they form with other nurses who are practicing through the float pool, allows for these folks to contribute to pensions, allows for these folks to pick up in the public system, which we've heard loud and clear from nurses they want to do. They just needed a tool that was flexible enough to support the ways in which they wanted to do that. And so working with nurses, working with doctors, working with leaders, working with folks across the system to make sure that we are being strategic about how we hire is really important. You know, the Recruitment and Retention Office allows us this really wonderful opportunity to work directly with communities to better understand their needs and to have a line of sight into how it is that we can work with them to develop a long-term sustainable approach that works for them. It is something that folks have already articulated has instilled hope and confidence in their ability to really work with government as a partner. And it allows for us as a government to plan long-term. Certainly the goals that we've outlined speak to Budget 2024 and into 25, speaks to 4321 over 5 years. But really it's about what do we do in this budget that sets the tone and establishes a strong foundation for what we do every year after that, and that will benefit Manitobans long-term across the province. And so we will hire healthcare workers of all stripes absolutely everywhere across the province, and as many as we possibly can. But we're going to do that in partnership. We're going to be strategic, take a targeted approach to make sure that where we see areas of increased need, that we're working in creative ways and innovative ways to meet those needs, investing in strategies like the float pool to enhance our ability to support nurses and having unique ways to practice in the public system, and investing in making sure that the beds that are actively coming online, that are adding back capacity that was cut from the system, are staffed with people who are dedicated to providing quality care at the bedside that Manitobans deserve.
Thank you, Minister. The honourable member for Roblin.
Thank you. The minister mentioned the float pool. How many nurses, I guess, have signed up for the float pool?
The Honourable Minister.
Thank you, and I thank the member for that question. The float pool is an innovation specific to Manitoba that is garnering envy from other jurisdictions. Again, I think it's so important that we celebrate the good things that are happening in healthcare in Manitoba and that we are not quiet about them. I know that perhaps maybe we're more humble than Ontario, or Winnipeg's more humble than Toronto, or there's debates about that. But I do think it's important for Manitoba to flex a little bit in terms of the things that we're doing here that are innovative, that we're seeing positive impacts as a result of. And the float pool is certainly one of those areas, which is a significant reason why our government has invested in expanding and enhancing the float pool and supporting nurses in having the opportunity to practice via the float pool if they so choose. It is a great tool for strengthening the public healthcare system, for bringing nurses back to the public healthcare system, and doing so in a way that isn't just rooted in incentives or things like that, but it's rooted in collegiality. And I mentioned that before because when I had the opportunity, and as I've had the opportunity to learn about how the float pool has evolved and what investing in the float pool allows for the folks who are doing the work around enhancing it to do, it's incredible to see how it's really evolved into a tool that equips nurses with the partnerships and resources that affirm that working in the public healthcare system is the place they want to be. And so the fact that we have 150 nurses in the float pool is a great success. And it's something that we are continuing to grow. It is a number that reflects the appetite of nurses to return to the public system. Previously, under the previous government, there were hundreds, literally hundreds of nurses who wanted to be a part of the float pool, but they lacked the capacity to onboard these folks, and they lacked the capacity to establish an approach that afforded nurses flexibility around part-time capacity and working in specific other regions. And so our government, using Budget 2024 to invest in enhancing and strengthening the float pool, has had tangible results. In the last 2 months alone, we've seen 1,000 shifts filled by the float pool. That is an impressive number when I believe the total number is somewhere around maybe 3,500, somewhere around there. So in the last 2 months, we're seeing the benefits of our investments already paying off. We have communicated consistently with float pool leadership that this is a priority, and to action the enhancements, to work together to communicate to nurses this opportunity. And we're seeing the benefits of that. And so we're going to continue to make targeted investments like into the float pool that afford nurses the opportunity to have flexibility and work-life balance. We're going to continue to onboard nurses as assertively in terms of timeline as we can into the float pool, and to find increased ways for them to work across the province. So, expanding the capacity of the float pool under our government has resulted in Prairie Mountain Health, in Southern Health, being able to utilize the float pool, which has been a wonderful, wonderful tool for them, a great lever for them to pull in terms of making sure that they've got folks working in the public system through the float pool. And it really allows for regions that have unique challenges in staffing to have another way that they can staff at the bedside and on the front lines, and know that the nurses through the float pool also have the benefits of that structure. Again, being able to contribute to pension, being able to pick up part-time, being able to be part of a network of nurses that are supporting one another in this framework. It's unique to Manitoba. It's something that we should be really proud of. And it's certainly an area that we're going to continue to strengthen to the benefit of patients and to the benefit of nurses who want to come back to the public system.
Thank you, Minister. The Honourable Member for Roblin.
Thank you for that. I'm going to shift gears just a little bit. So I think we all agree that reducing reliance on agency nurses is an important goal. But in order to measure performance in that area, you have to know where you're starting from. So I'm sure the department has this answer readily available. I'm wondering if the minister can provide the current agency nurse hours by RHA to the most recent month available, I guess.
The Honourable Minister.
Thank the member for that question. I'm just going to go by region. So WRHA 43,973. Prairie Mountain Health 340,515. Southern Health 127,39. Interlake Eastern 184,848. Northern 146,664. I will do the quick math for the member and say that totals 836,664. And that was as of December of 2023. And so I think it's important to talk about, to contextualize this a bit. And so, what we have heard, what I have heard really plainly from regional health authorities are that they have been facing some very obviously significant challenges over the years, but certainly that they also want to reduce the overutilization of agencies in Manitoba. It is a challenge across the country, but certainly here in Manitoba, we have an important opportunity to strengthen public health care, to attract healthcare professionals, nurses back into the public system, which is why, again, and I'll keep talking about it because it is a very important tool and investment that we've made in the float pool, not only to reduce the use of agencies, it's certainly economically, it makes sense to invest in the float pool and have nurses return to the public system, but it is also about strengthening care in ways in the system as well. We know that the public health care system, it's a fundamental Canadian value to have public health care, to have a strong public health care system, and Manitobans count on consistency, quality care, nurses who have the opportunity and the time to build relationships with their patients, with their families, with communities, and nurses who have a strong work-life balance so that they're able to show up to work and know that their plans to be there for that shift are going to be honored and that they have control over their schedule. And the float pool allows nurses to have that control. And it allows for consistency in the quality of care that's being provided. And it's a great tool here in Manitoba that we will continue to strengthen and invest in so that we have nurses returning to the public system, moving away from this over-reliance and dependency on private for-profit agencies. And ultimately, this benefits Manitoba patients. Certainly, I can appreciate that regional health authorities in previous years didn't have a willing partner at the table to work with them. They didn't have a government willing to work with them, invest in strategies that allowed for them to not increase their reliance on agencies. And so that work and that culture change around the approach to staffing healthcare is going to take time, but making the decision to invest in enhancing the float pool, making the decision which we have shared more recently with the public to make sure that we've got some quality controls in place when it comes to agency use in Manitoba is really important. And so we're doing something that has not been done in this space in the province, where we are taking steps to move healthcare in a direction which we haven't seen in the past 7.5 years, to strengthen public healthcare, to have greater fiscal accountability in healthcare, which Manitobans have entrusted us to do, recognizing it's going to take us time to move things in a better direction. But certainly, Manitoba, when you look at our demographics and population distribution, per capita details, makes no sense that we have the number of agencies in our province operating in relation, for example, to British Columbia, who, we've got, I'm not even sure, maybe it's 5 times as many agencies as that jurisdiction. So there's work that we are doing to make sure that we are supporting quality of care in Manitoba, that we are taking a more fiscally responsible approach, and that we're supporting nurses and healthcare workers in having a good work-life balance in the public system, which is what we've heard loud and clear they want.
Thank you, Minister. The Honourable Member for Roblin.
Thank you. I appreciate the answer and the context around it. And I do appreciate the value of the float pool in helping to reduce agency use. I'm just wondering what specific other incentives have been offered to encourage nurses who have left for agencies to come back to the public system.
The Honourable Minister.
Yeah, that's a really, really good question. Certainly, again, the flow pool is a part of a larger approach. It's been fascinating, kind of heartbreaking, quite frankly, at times to hear from nurses on the front lines that they have felt unheard and ignored for years. And as somebody who worked on the front lines in acute care, in long-term care, in mental health, in addictions with youth, adults, seniors, I know what it means when you have leadership that values your voice. And I also know what it means for nurses if you do not have leadership that values your voice. I was a frontline nurse working in an acute care setting and in community back in 2016, and pretty quickly saw some shifts that made it more difficult for us on the front lines to provide the standard of care that we showed up every day at work counting on being able to provide our patients. And what I've heard from nurses on the front lines are stories of frustration, of not being heard over the past several years. But I've also heard stories of hope. I've heard inspired ideas, optimism from people who know that they have leadership in government that wants to hear from them directly. And I'm not exaggerating when I say I speak to healthcare workers every single day of the week. At all hours. Shift workers work at all hours. And so, I make myself available for when folks are available. And I think there's a real generosity of spirit here in Manitoba, where healthcare workers will go out of their way and above and beyond to share their ideas and their concerns and their hopes and want to be a part of moving things in a better direction. And we can't take that for granted. And so the flow pool, yes, is one area we've invested to really enhance work-life balance, attract folks back to the public system, and a myriad of other things. But certainly the listening tour has been a really great opportunity and mechanism for us to learn from the front lines, to listen to their expertise, to meet them exactly where they're at, provide some coffee, some muffins, and sit in a space where they have the opportunity to share what they have not been able to get across for some time. And then to keep those relationships going. Having the online platform, Engage MB, where folks can share in that way if that's their comfort level. Creating opportunities for job opportunities in the healthcare system, looking at ways in which we can support folks being trained in their own communities. We are investing in communities like Nipawa so that LPNs can be trained in rural communities. These are all ways that our government is investing in nurses across the province, listening, employment opportunities that provide work-life balance, training opportunities so that they can get the education that they want in their home communities and stay in practice in their home communities. We know how important that is to folks. There was a nurse here, Tamara, a couple of weeks ago for Indigenous Nurses Day, for National Nurses Week. And it was incredible to see this nurse who we advocated with while we were in opposition, born and raised in Manitoba, First Nations Indigenous nurse, to be able to practice in her own province without the barriers that were in the way. And that advocacy and that work, we do that work in government now in partnership with colleges, with folks like Tamara, so that they can be successful in practicing in their own communities, it's incredible to see that she's able to do that work now. And so we build those relationships. We invest in the grow your own approach in communities. We get to the bargaining table, right? We don't shut people out for 4 and 5 and 5.5 and 6 years from the table where we're supposed to meet them where they're at and try to come to a solution in terms of folks having agreements that work for them. And so is it all absolutely perfect? No, we're a listening government. We're open to learning and adapting and being flexible, but we're committed to doing that work with folks. And we're seeing the benefits of that, recognizing there's still a lot of work to do, but we're going to do that in collaboration. We're going to do that work together.
Thank you, Minister. The member for Roblin.
Thank you. And I appreciate that the minister is always talking to healthcare workers. I believe it. I also talk to healthcare workers because they call me. And that was the genesis of my question in question period today, where I tabled a document that had been sent to me by a nurse who was concerned, didn't like what was on offer in the collective agreement. And so I want to ask about, when it comes to agency nurses, what is the meaning and intent of that clause in the proposed collective agreement? And I'll read it so that it's very clear which one I'm asking about. It reads, preclusion that clearly prohibits agency nurses working in the same EO that they hold a position in. I want to ask what the meaning and intent of that is specifically.
Honorable Minister.
Yeah, sorry, it's just a question. Yeah. Can the member table that?
Yes. I'll have to get it.
Sure, thanks.
Member for Roblin.
Yes, we'll get that to table. While we're getting that, I'll divert to a different question. Last week, the Premier mentioned that the government plans to validate nursing agencies, which I know the Minister's already touched on as a quality management measure, but I'm just wondering if the Minister can provide more details around how that will work, the timing, when agencies can expect to have to apply, or whether this will be done through an RFQ process, and most importantly, how the Minister expects that to impact healthcare delivery in the short term.
The Honorable Minister.
Sure. I will take a moment just to highlight all of the places where nurses are working via the float pool, and then I'll follow up on the member's question about agencies. So the Northern Regional Health Authority, there are nurses via the float pool working at Thompson General Hospital, Gillam Hospital, Northern Lights Manor, St. Anthony's General Hospital, the Paw Health Complex, Lynn Lake Hospital, Flin Flon PCH, Flin Flon General Hospital, Northern Spirit Manor, Paw Home Care, Snow Lake Health Center, St. Paul's PCH, Flin Flon Home Care, and Leaf Rapids. In the Interlake Eastern Regional Health Authority, float pool nurses are working at Pine Falls Health Complex, Beausejour Health Center, Selkirk Regional Health Center, Ashland Hospital, Stonewall and District Health Center, Sunnywood Manor PCH, and Ericsdale PCH. In Prairie Mountain Health, Dauphin Health Center, Dauphin PCH, Brandon Regional Health Center, Swan Valley Lodge, Minnedosa Health Center, Swan River PCH, Benito PCH, Glenboro Health Center, Bertle Transitional Care PCH, Gilbert Plains PCH. In Southern Health, which is one of the more recent, so Prairie Mountain as well, one of the more recent, but in Southern Health, float pool nurses are working at Portage District Hospital and Boundary Trails Health Center. I think that's important to note. Those are a number of healthcare sites, personal care homes that would otherwise be dependent solely, likely, on utilizing agency nurses. I think it's important to reflect on something that I've heard from folks in terms of why does it matter in Manitoba? Why is it important that we change the approach in terms of the utilization of agency nurses and for-profit agencies in the province? The obvious one that stands out, I think, to most Manitobans is the fiscal burden that it places on our system when agency nurses are being utilized in the manner that they are. I've also heard from frontline nurses, from healthcare workers, that the approach in terms of utilizing agencies has become so quick in terms of folks accessing agency versus taking an approach that would first and foremost work with nurses in the public system on the front lines. And so being able to support nurses working in the public system via the float pool, being able to work with regional health authorities to change the culture around the approach to staffing is really, really crucial here. You know, these regional health authorities, I said it earlier, for years, and I've heard this from folks, didn't have a partner in government. I am always surprised when I visit a hospital or sit with a board chair and I hear from them that that's the first time they've ever had a conversation directly with the health minister. That in the last 7.5 years, they never got a phone call, they never had a meeting, they couldn't get FaceTime, that their voices were not heard, I think speaks to a culture in healthcare that needs to be addressed, that our government is working to address. Will take time to really shift it in the right direction, but we're every single day working with our partners to do that work and working in supporting the front lines to do that work. And so making sure that we are implementing an approach to agencies that ensures that we actually have a line of sight into how decisions that are being made in terms of how nurses are deployed. As one example, because I've heard, and maybe the critic has also heard, I'd be curious to know from folks who there have been situations where, you know, an agency perhaps has deployed or sent out a nurse who actually doesn't have the full breadth of expertise that one would expect for that particular area of need. And we've got the best people in healthcare right here in Manitoba. We have the best nurses in the country working in healthcare in Manitoba. But certainly as a government, there's more that we can do and that we should do in making sure that we have a line of sight into how agencies are operating in this province. It can't be a free-for-all. It just can't be. It's been a free-for-all for the past 7.5 years. It's not sustainable for it to be that way in Manitoba long-term. Manitobans expect a more responsible fiscal approach. They expect nurses to be motivated to work in the public system and supported, and they expect consistency in the quality of care. And so taking the approach that we will be moving forward will support all of those areas.
Thank you, Minister. The Honourable Member for Rothland, have the document.
Yes, I'd like to table the document I referenced earlier and just restate my question. What is the meaning and intent of the clause regarding prohibiting nurses working for an agency from working within that same EO?
Order, please. The hour being 5 p.m. Committee rise.
Thank you.